welcome to Time-Based TV on Health Sector. On this episode, we will be discussing about the 2020 budget as President Muhammadu Buhari has presented 10.33 trillion to the National Assembly. Right here, right now, we're on the streets of Kano. Follow me as we sample the opinion on people of Kano. I'm your guide, Nefisa Al-Hassan. Can you tell us your name and where you stay?
My name is Mustafa Hekima and I stay here in Kano.
Okay. I'm sure you are aware of the 2020 budget.
Definitely.
So can you tell us your expectations for the 2020 budget on healthcare sector?
Well, I expected that I will see some increase in the allocations to health,
Okay.
Especially considering the Abuja Declaration, which provided that African countries should aim at reaching 15% of their budget allocated to health.
Which aspect of the health center do you think needs more funding? Like which aspects do you think?
Well, healthcare provision can be divided into three. There's the primary healthcare, there's the secondary, and there's the tertiary level.
Okay.
I think if you have a very sound primary healthcare, I think it will go a long way in improving the health of the people, because most of the requirements of health provision by most of the people in any part of the country are actually under primary health care.
Okay.
But unfortunately, most of our primary health care institutions are dilapidated. They lack equipment, they lack personnel, and so they are not functioning properly.
So what do you think has more funding? Is it the health sector or the security?
Well, from what I saw, I think security took much more than health.
Okay, what is your perfect image of the healthcare centers?
Well, a healthcare center should be assessed based on what it is expected, the kind of service that it is expected to provide. For example, like we said, we have primary healthcare service centers, we have secondary, and we have tertiary. So I think a perfect primary healthcare center is the one that is able to provide all the necessary services that are expected of a primary healthcare level. We have a situation now in the country whereby you go to tertiary healthcare institutions and you see them giving services, rendering the services of primary healthcare centers, because those primary healthcare centers are incapable of performing at their best. So I think when you have the primary healthcares, functioning optimally, the secondary healthcare centers functioning optimally, and also the tertiary healthcare centers functioning optimally with adequate staff, adequate equipment, and adequate number of the hospitals or the healthcare centers, because they are grossly inadequate in most parts of the world.
Okay.
If we have all this working hand in hand, I think we can say that we have a perfect healthcare system. But I think finally, one fundamental thing as far as healthcare provision is concerned is the extent to which National Health Insurance Scheme covers the population. I think the government should be very much interested in expanding the coverage of healthcare, national health insurance, which is just about 1% now, so that many people can afford to go to the hospital and access healthcare.
Can you tell us the name and where you stay?
My name is Kabiru Sufi and I stay at Hotoro GRA.
I'm sure you have an idea about the budget of 2020.
Yes, somehow.
So can you tell us your expectation concerning the health sector?
What has been allocated to the health sector, in my own opinion, is grossly inadequate. I mean, considering the fact that we have large number of tertiary health institutions in the country.
Okay.
You look at our own teaching hospitals, you look at neuropsychiatric hospitals, you look at orthopedic hospitals, you look at all these tertiary health institutions need a lot of money to be administered. So when you allocate that small amount of money, I can say that we do not expect them to be run smoothly. You need more to run them effectively. Despite the fact that some of them generate little amount of money, but that still has to be augmented with a large budgetary allocation. So they need to be funded by the budget. And so when you allocate small amount of money, people might start expecting crisis in the tertiary health institutions, especially even at the way they are going, they are complaining. And then when you allocate less, it means you are going to expect more complaint from those tertiary health institutions.
Okay. So which aspect do you think needs more funding in the healthcare?
I think a primary healthcare section needs more funding. Maternal and child sector needs more funding. And of course, the tertiary health institutions that I mentioned, they also need special intervention and attention.
Okay. What do you think has more funding? Is it the security or the healthcare?
Yes, going by the allocations in the budget, security has more than health.
What is your image of healthcare centers in Nigeria?
Yes, what we need is healthcare centers that will be able to compete with their peers in other countries of the world. I mean, when we have orthopedic hospitals, I mean, they should not be living in the 19th century. They should be up to date. They should be providing, I mean, services that are really desired and needed and up to date. Same with all the other tertiary institutions. Same with our primary health care. They should be equipped in such a way that we live in, a modern day Nigeria. We should not be living in the past. So they should be there. The doctors should be there. The nurses should be there. All paramedics should be there. Everything should be in place in all these tertiary institutions.
Can you tell us your name and where you stay?
My name is Grace from Tarauni.
Okay. I'm sure you have ideas concerning the 2020 budget.
Of course, yes, I have.
So can you tell me your expectation for the 2020 budget concerning the health sectors?
My expectation on the 2020 budget concerning the healthcare sector is more attention should be given to maternal health care. More women are dying, and most especially the women that are in the rural areas, those hard to reach areas, they are still dying, and no postnatal, no antenatal, full antenatal care there. Okay. They don't have good consultants nor midwives that will take care of them. And no proper nutritional education. Okay. The government is supposed to look into this aspect to help women. We want to see women having children, healthy children, and delivering their children safely.
So what aspect do you think needs more funding?
I think the maternal issue, as far as I'm concerned, is the main thing now. Okay. If that is taken care of from postnatal, from antenatal, delivery, and even at postnatal, if that is properly taken care of, most of the problems will be reduced, if not fully solved. The next thing I will seek is drugs.
So what aspect do you think has more funding? Is it the security or the healthcare?
Of course, the security is too much.
So what is your image of a perfect healthcare centers?
Image of a perfect healthcare center. Is it at a bigger level or at a rural setting? If it's at a rural setting, because that is where the main problem is. At the rural setting is drugs for all these our normal ailments like malaria, typhoid, and what have you should be available. Okay. Nurses and midwives should be available. At least 2 consultants should be attached to that particular health center, and they should be prompt. They should be coming and be punctual in their activities. That's all. If we can have all these things, we have beds, and then maybe 24-hour service if possible. If not, maybe 18 hours for women for them to have receive delivery. It will help and go a long way in reducing mother and child mortality.
Okay. This has brought us to the end of this episode. Don't forget to like, comment, share, and subscribe to our YouTube channel at Time Based TV. Thank you.